I'm Pamela Norton. I had a nerve decompression surgery on the back of my head for migraines on July the 2nd, 2013. I've been on basically all the medicines that are out there for migraines, Imitrex, Trexamet, all of in that family, Fioricet, Midrin. It had gotten to the point where basically nothing was working, and they had me taking hydrocodone with my migraine medicine just so I could get enough relief to sleep. I would take at least 2 every time I had a migraine, and my migraines usually lasted either 2 days to an entire week. At some points I was having them daily for almost 2 months, so I was taking a lot of medication. Throughout the years I would have periods of where I'd have, a series of migraines, and then I wouldn't have any more for a month or 2 or 3. I'd get on new medication that would help a little bit, and then it would stop working, and then I'd have them where I would getting them every day, and so there's really no way to know when you're going to get them, how long they're going to last. And toward the end of this past summer, I was having them daily for so long I couldn't work. I was on an extended leave from my workplace. I had to be on unpaid leave, and it just drastically affected my life, not only because I wasn't making money and I had to pay bills and everything. I was also really worried about having so much extra work on my coworkers and things not getting done, and just feeling like I had let everybody down and was causing problems. And it has cost me jobs in the past, the fact that I have migraines so often. And even when it hasn't cost me my job, it's a huge stress level to have to worry about, will I be able to meet this deadline? Will I be able to work? I think that it wasn't necessarily that I felt people didn't believe that I had migraines. I think they didn't understand the severity of them, because migraines are different in everybody, and they affect people differently. And a lot of times people will just kind of casually, oh, I've got a migraine today, I'm not feeling well. And every time I would hear that, I think, gosh, I wish I had your migraines, because when I have one, I'm curled up in bed for 24 hours, and sometimes I'm crawling to the bathroom to be sick because I'm just in that much pain. So I think people believed me, and I didn't ever worry about, oh, they think I'm just making it up to miss work, or go play hooky and go to a baseball game or something. But it was kind of, it makes you feel guilty almost. You can't help being sick, but knowing that your coworkers are having to cover for you, or your anybody that's in a project with you or anything, and they're probably having to, oh gosh, she's sick again, we can't count on her. That was more what bothered me than thinking, oh, people just don't believe me. I think anybody who's ever seen me while I was having one, or even a few days afterwards, knew that it was real, because you could still see the pain, just in my face. And I called it a migraine hangover, honestly, because you just kind of drug around even after the headache was gone. So I was lucky that everybody I ever worked with knew how severe migraines could be. So I never got called a liar or anything like that. But at the same time, they're paying you to work. If you can't be there to work, there's not really a lot people can do about it. Since the surgery, I haven't had any migraines at all. I had lost my job right after I had the surgery, and then I've recently about to start a new job, so I was really happy about that. I wanted to be careful and not work before I knew that the surgery had been successful, so I waited for about 6 months to make sure I was migraine free, and that's probably the first time since I was 15 years old that, or 17 years old, that I haven't had any migraines. So I was really pleased with that, and I'm starting a new job, and I'm really hopeful that this one can be a long-term career. I was diagnosed with them in high school, and they've gotten worse as I've gotten older. Usually for me, it was more a matter of the release of stress. So like right after finals, or some project that I was involved in, as soon as it was over, I'd just start migraines. I'd crash, and I'd wake up with them, so I couldn't tell, oh, a migraine's coming on, let me try and pre-treat, as soon as possible. I'd just wake up in horrible pain, and I couldn't bear light or sound. So when I was in high school, I missed a lot of classes due to the migraines, and had to go in on Saturdays to make things up, and make up a lot of tests. And it's kind of difficult when you're 17, 18 years old to deal with that on top of, everything else. And the same thing in college. So the release of stress, sometimes they'd be just kind of monthly. Sometimes they would just kind of come out of nowhere if I'd been ill or had a lot of bad allergies, weather changes. I'd keep diaries trying to figure out what's a trigger, and they couldn't really narrow it down very much. So for me, it was always just a kind of a random day crapshoot. Am I going to get them or not? When I first met with Dr. Amirlak, we did a lot of questions about my history of migraines, my treatments, where they started, how they ended, did they move. So very thorough kind of background check just to get to know how my headaches worked. He made sure to check with my insurance company to see what they would cover and what they wouldn't cover, and started doing, they did a Botox treatment to see if that would help. So I came in while I was having a migraine, which was an ordeal in and of itself, and they did the Botox injections, and I never saw any relief from that. And so after that, they approved to have this surgery that Dr. Amirlak had told me about, and I'd done some research on, and very patiently kind of answered my questions and gave me some time to kind of come to terms with, oh my gosh, a surgery. And then when I decided to have it, they just scheduled and pushed through. So he was very thorough about, have we tried every other option? Is what we're going to do something that actually might be really helpful for you and your headaches, as opposed to something else that not quite as new or not quite as expensive, and just kind of progress through to the surgery being, all right, we've tried everything else, nothing has worked, let's do this. And I had nothing to lose at that point. I couldn't function on a daily basis. It was fine. I live locally, so it was outpatient for me. I came in, they did the procedure in about an hour and a half. Woke up all out of the anesthesia, and my parents brought me home that day. I didn't have to stay overnight. They had explained everything to me beforehand, so I really wasn't very stressed out about it or anything. I went home with a stent drainage tube that they removed. I came back in for a follow-up the next day, and Dr. Amirlak removed it, and that was it. I had to come in for follow-ups to check my progress and see how I was doing, but there wasn't any other issues with it. So they did have to shave underneath the top layer of my hair to make the incisions, and there were 3 incisions, and they have scars, but they are up in my hairline and underneath the top layer of my hair, so the scars don't show. And even when they had to shave my head for the incisions, that doesn't show unless I pulled my hair up. So it was really nice that I didn't have to worry about going around looking like Frankenstein. The incisions were fairly small, and they healed really well. It's a complete 180 difference in my life, just not having to worry every day about, will I be able to make this appointment? Will I be able to, meet up with my friends? Is it possible for me to get continuous work? And it seemed like before, even if I wasn't having a migraine, I was either recovering from the last one or worrying about the next one. It's just like a complete weight has lifted off of my shoulders and my head. I grew up in Fort Worth, and my parents still live there, and they've been very supportive when I was a child or a young adult living at home with the migraines. When I moved out, if I had a series of migraines, they'd come and and it helped me out. But for me, when I had migraine, I couldn't have any light around. I couldn't have any noise. So just simple things like going to the grocery store, or having to take out trash or do dishes or something like that isn't something that I could do on my own. And for me, luckily, my family was local and supportive enough that they would come and help me out. There's been times when I have lived farther away and had to have friends come and help out, or even there's been times when I had to take a taxi to the doctor's office because I just couldn't drive. So I've been lucky that my family was really supportive, but it was wearing on them as well. First of all, worrying about me being in pain and not being able to do anything, and then also, kind of having to say, well, we want to do this, we want to do that, and we really hope Pamela's okay to be there, for a wedding or a birthday celebration or any. There's been lots of family things that I had to miss because I had migraines and couldn't deal with it. And so now they're so excited for me. They're Dr. Amirlak's #1 fans, I think, because they've been able to tell a difference from almost the day after I had the surgery, just because I felt so much better. For me, it was because I'd been having daily migraines up until that point. So to wake up without a migraine was different for me. I did have nerve pain, just recovering from the surgery for about 2 or 3 weeks. That was headaches, because of the nerves reconnecting, but they weren't migraines. So the migraine relief was immediate. Recovering from the surgery wasn't immediate, but it wasn't too terribly long, considering what they had to do, and nerves are strange things. So I have not had any migraines. I've had, your normal sinus headaches, which, for me, it's just kind of like, oh yay, not a migraine. I had headaches caused by the nerves regenerating after the surgery, which were, a little bit more severe than a normal headache, but nothing as bad as a migraine. And like I said, they went away since then. Let's see, July 2nd, today's January the 22nd. I haven't had a single migraine. So I just think that he was the perfect doctor to do this surgery. He's very matter of fact to tell you it works for a lot of people. Some people it doesn't, it doesn't cure them completely. He was very honest about the side effects and what I could expect. If there was anything that was happening before or during the surgery that would have put my health at risk, I know he would have stopped, and not continued. He definitely made me feel like he had my best interests at heart, not just doing surgery for surgery's sake. And some of the doctors that I've dealt with in my life, that's not always the case. So I felt like he always looked out for the patient's best interest, and not just Dr. Amirlak, but all the staff around, the nurses and the receptionists, and everybody went out of their way to make sure that I was as comfortable as I could be. If I freaked out about the thought of having a surgery, they made sure to answer any questions or direct me to, research or news stories about it. And when I came in and I was having a migraine, they put me in a quiet, dark room and tried to be really quiet. And everybody did a wonderful job. And the fact that Dr. Amirlak does the surgery and feels very confident in his abilities to do the surgery just took the pressure off of making that decision. So I just want to tell him thank you.